As we get ready to celebrate mothers this weekend, we also think about the people trying to become parents. Experts say Illinois is among the best states when it comes to addressing infertility, and lawmakers actually passed a mandate to cover healthcare services for the diagnosis of infertility. Joining me to discuss this is nurse practitioner at McKenzie with Advance Reproductive Center. Hi, welcome.
Hi, thank you so much for having me.
Of course. So what is the fertility coverage mandate? What does that mean exactly?
Sure. So we are actually very lucky in Illinois. There are now 19 states that have a mandate, and mandate means that we are required, we mean Illinois and the other states, required to provide infertility coverage.
And so what are the requirements or limitations of this?
Sure. So requirements are you either live in Illinois or you work somewhere that has a plan for infertility throughout Illinois. So it has to be a plan through Illinois. There are some limitations, though. However, if you had sterilizations that were not medically necessary, that unfortunately is a limitation. But the requirement is live in Illinois and or have a plan through Illinois.
Okay, gotcha. So obviously, before we get to even that point where we're looking for coverage, how does someone know that, okay, maybe I need to look into what my options are if I want to have a child?
Absolutely. So there are actually guidelines. So 35 and over, you need to be trying for at least 6 months. 35 though and younger, we do recommend 1 year of trying. That is what insurance says. This, of course, does not affect same-sex couples.
Okay, so where does someone start? They have been trying, say, for 6 months or the year. Where do they go from there then?
A lot of people start talking with their primary care provider, or
Mhm.
women usually speak with their OBGYN. The OBGYN might do some testing, but ultimately it is important to reach out to a fertility provider just because every case is a little bit different. And it's hard to predict future fertility in women. So start talking with your OB, but definitely keep us in mind.
Okay, and like you said, everyone's treatments might look a little different. What treatments are available at your clinic specifically?
Sure. So we do anything from what we call natural cycles, where you do not take any fertility medication other than a medication to make you ovulate. And we do inseminations timed around that. Above that, we do Clomid and letrozole cycles paired with an IUI, which is an intrauterine insemination, or timed intercourse. Above that, very rarely do we do gonadotropin cycles, which means injectable cycles paired with insemination, because the risk of multiples and that is just too high. So usually from Clomid and IUI, we do go then to IVF, but we do offer comprehensive care from minimal to, most invasive.
Okay, is there anything else you think people should know about this, or what's the best way to get in touch with someone at your clinic?
Absolutely. You can always call the office. Here we do have actually offices in Arlington Heights, Rockford, as well as Peoria. You can always just give us a call. You can speak with your OBGYN first. I think the most important thing, though, is just to keep talking about it. You shouldn't be ashamed. If you're having problems getting pregnant, you definitely are not alone. It affects
Hmm.
as many as 1 in 6 couples.
Wow.
So please just reach out. Please, we are definitely here for you. I know that Mother's Day can be an incredibly difficult day, so we are
Yes.
here for you.
All right. Well, thank you so much for being here. We appreciate it.
Thank you.